Did you ever wonder if the pills you take could secretly harm your liver? Every pill you swallow goes through your liver, and it could be damaging it without you even knowing. Surprisingly, over 2,000 cases of acute liver failure happen in the United States every year, and many of them are because of medications or supplements. Are you curious to find out which common medicines or drugs could be causing this? Join us as we delve deeper into the concerning effects of medications on the liver. Welcome back to our channel. In this video, we'll explore how certain medications can negatively impact the liver. It's crucial to understand that some medications can harm this vital organ. However, there are 10 specific medications that present a heightened risk and can significantly impair liver function. Hence, it's essential to recognize these medications and refrain from overuse. But before we delve into the top 10 harmful medications for the liver, let's take a brief pause to understand the liver's role and recognize the common signs of liver damage. Liver's function and symptoms. The liver performs a crucial role in purifying your body by filtering out toxins and harmful substances. It metabolizes alcohol, drugs, medications, pesticides, and other compounds, expelling waste through bile and urine. However, certain substances can be detrimental to the liver due to its detoxifying function. Recognizable signs of liver damage encompass stomach discomfort, fever, diarrhea, queasiness, vomiting, darkened urine, pale or clay-colored stool, jaundice, weariness, itching, and skin irritation. The duration for medication-induced liver damage to manifest varies based on factors like age, individual susceptibility, dosage, pre-existing liver conditions, and alcohol consumption. Typically, symptoms of liver impairment from medications emerge within 5 days to 3 months of initiating treatment. Medication-induced liver damage. When considering the impacts of medications, it's essential to understand that alcohol consumption can also result in significant liver damage, contributing to around 10% of liver transplant cases. Furthermore, illicit substances, such as cocaine, can exert harmful effects on the liver as well. It's vital to emphasize that the information provided in this content is solely for educational purposes and should not be construed as medical advice. It is always prudent to seek personalized medical guidance from a healthcare professional. If you're currently taking any of the medications we're about to discuss and they have been prescribed by your doctor, it's imperative not to discontinue them under any circumstances. These medications play a pivotal role in managing specific health conditions. Therefore, as long as your doctor is overseeing your treatment, it's advisable to continue using them as directed. With that clarified, let's dive into the top 10 medications that damage your liver, especially the last one, which will leave you shocked. So, keep watching until the end. Let's get started. 10. Diclofenac anti-inflammatory medications such as ibuprofen and naproxen have the potential to induce liver damage, albeit uncommonly. Nevertheless, diclofenac poses the highest risk of liver injuries among this group. These adverse effects might become apparent several weeks or even months after initiating the medication. Thus, it's essential to recognize that diclofenac can impact not just the kidneys but also the liver. 9. Amoxicillin with Clavelin. When amoxicillin is combined with clavelinate, it forms a widely used and highly efficient antibiotic for treating various infections. Despite its efficacy, there is considerable apprehension regarding this medication. It has been associated with numerous instances of acute liver injury, a critical condition that necessitates timely identification and intervention to prevent severe outcomes. 8. Amiodarone. Amiodarone, also recognized as cordurone, is a medication frequently prescribed by cardiologists for treating cardiac arrhythmias. It is remarkably effective in addressing arrhythmias and can even lead to clear 24-hour Holter records. Nonetheless, it's essential to acknowledge that amiodarone carries a high risk of side effects, affecting not only the thyroid, lungs, and skin, but also the liver. Due to these adverse effects, its usage has been increasingly restricted, with doctors opting for it only when the potential benefits outweigh the risks. 7. Allopurinol. When dietary adjustments aren't sufficient to manage high uric acid levels or gout, doctors frequently recommend allopurinol. This medication effectively reduces uric acid levels in the body and aids in preventing gout attacks. However, it's crucial to be aware of the potential negative impacts on the liver associated with allopurinol use. Liver damage linked to allopurinol can develop quickly, with symptoms sometimes emerging within a short period after starting treatment. As a result, individuals starting allopurinol therapy should undergo close monitoring for any indications of liver problems. 6. Antiepileptics. Some drugs, such as phenytoin, dilantin, and valproic acid, have the potential to cause liver damage. Liver injury from phenytoin may occur shortly after starting treatment, while the effects of valproic acid may become apparent within 1 to 6 weeks. It's essential to regularly monitor liver enzymes to detect any problems early on. Although less common, liver issues can also arise with medications like carbamazepine and levetiracetam. 5. Methotrexate. Methotrexate is frequently prescribed to treat rheumatoid arthritis, psoriatic arthritis, and specific types of cancer. However, it's crucial to conduct regular monitoring of liver enzymes because liver damage can occur as a potential side effect. The extent of liver injury resulting from methotrexate use may differ, underscoring the importance of early detection and prompt management. 4. Antifungals. Medications, such as fluconazole and itraconazole, which are used to treat fungal infections such as candidiasis and nail fungus, have the potential to cause liver issues in certain patients. If you're prescribed these medications for fungal infections, be mindful of the signs of liver toxicity mentioned earlier. 3. Methyldopa. Methyldopa is frequently prescribed to manage high blood pressure, particularly in pregnant women with hypertension, as it is deemed safe. However, it's essential to be aware that methyldopa may lead to liver damage, making it unsuitable for those with liver conditions like fibrosis or cirrhosis. Liver issues associated with methyldopa treatment can arise within 12 weeks of starting the medication. 2. Antipsychotics. Antipsychotic meds like risperidone and quetiapine, also called Seroquel, help with mental health issues like schizophrenia and bipolar disorder. But these meds can harm your liver. Liver damage can happen as a side effect, messing up bile flow. So it's super important to check your liver regularly if you're on these drugs. Keep an eye out for signs like yellow skin, tummy pain, or feeling extra tired, and tell your doc right away. Being aware and staying on top of your health can make a big difference in staying safe while managing your mental health. 1. Paracetamol. When we talk about paracetamol, it's the most common medicine linked to liver failure caused by drugs. Usually, liver problems happen when people take too much, not when they stick to the right dose. It's really important to stick to the recommended dose of paracetamol to stay safe. Taking more than you should can lead to serious liver failure, which can even mean needing a new liver through a transplant. So instead of reaching for a paracetamol pill right away when you have a mild headache or something similar, it's better to figure out why you're feeling that way and try other remedies first. Conclusion. So there you have it, the top 10 harmful medications to the liver. It's important to understand that just because a medication isn't listed, it doesn't mean it can't harm your liver. There are many medications, including antiretrovirals, vitamins, antibiotics, supplements, and even teas, that have the potential to damage your liver. Since the liver is a crucial organ that affects the entire body, it's crucial to be extremely cautious when using any medication to prevent drug-induced hepatitis or, in severe cases, fulminant hepatitis. So always try to minimize the intake of medication if your healthcare professional agrees to it. Before we wrap things up, we'd like to hear from you. Did you enjoy the video? Did you learn about medications that can harm your liver? Let us know in the comments below. Remember to share this knowledge with others and subscribe to our channel. Thanks for watching, and remember, stay informed, stay healthy. See you in the next video.